So in this video, we're going to talk about why you actually feel shoulder pain, weirdly, if you have some sort of inflammation or maybe even gallbladder stones. So some sort of inflammation of the gallbladder or some sort of pathology of the gallbladder. Like, why do you feel this weird shoulder pain and how do you explain it? Well, the idea is that the visceral efferents, so the idea is that the visceral efferents uh, from the gallbladder, right, and the biliary apparatus actually follow sympathetics, right? So the visceral efferents from the gallbladder actually follow sympathetics. So these follow sympathetics. These follow sympathetics to T7, T9, the T7, T9 spinal segments. So these are the spinal segments. So this is pretty much straightforward. The visceral efferents, or the pain fibers, they're traveling with the sympathetics back to the T7, T9 spinal segments. And so this is why if you have an inflammation or some sort of pathology of the gallbladder, like, so let's use inflammation in this case, the pain is simple, straightforward. You will feel it in the right upper gastric, uh, the right epigastric portion, right? So right under the liver, you'll feel that pain right there, right? Pain is not as sharp, but you still feel it. Now, what explains the pain? What explains the pain that we actually feel here? What explains that? What explains the pain that we actually feel here? And the idea is that we have the diaphragm. So so right under the liver we have the gallbladder, and just superior to the liver, right? So the liver is this big thing. We have the gallbladder right under the liver, and just superior to the liver is our diaphragm. So what occurs is that the gallbladder can get inflamed so much that it starts pushing against the diaphragm. And as a result of it pushing against the diaphragm, remember the diaphragm has dermatomes of C3, C4, C5. And as we say in medicine, C3, C4, C5 keeps the diaphragm alive. Now it so happens that the C4 dermatome is actually in the shoulder. And so as a result of the gallbladder getting larger and larger and larger and pushing against the diaphragm, the patients actually complain of pain and discomfort at the inferior angle of the scapula, right? So this is the dorsal side, and I know this is a terrible drawing, but this is the dorsal side of the patient, right? So they complain of pain at the inferior portion of the scapula, and this is and this is why. So shoulder pain, it's very serious. So if you're experiencing some kind of shoulder pain in that regards, you might want to get it checked out.